Hello everyone. Welcome back to this session on self-help acupressure. In this session, we will discuss how to handle symptoms pertaining to the gastrointestinal tract and other abdominal organs by oneself. The common symptoms to be addressed would be abdominal pain, acidity and heartburn, nausea and vomiting, constipation and diarrhea, and also symptoms pertaining to dyspepsia and the irritable bowel syndrome would be touched upon. In the treatment of GI disorders, acupuncture points on the paired channels of stomach and spleen are generally chosen. The unpaired channels crossing the abdomen, namely the Ren and Du channels, also assume importance. By far, the most important and widely used points for abdominal ailments are stomach 36, spleen 6, and Ren 12. With the knee flexed, lateral to the patellar tendon is the eye of the knee or stomach 35. 4 fingers below this and 1 finger breadth lateral to the anterior crest of the tibia is stomach 36. This point is the best homeostatic point for GI disorders. Four fingers above the medial malleolus on the posterior border of the medial crest of the tibia is the spleen 6 point. At this point, the liver, kidney and stomach meridians are connected. Pressure here tonifies all these 4 organs. Ren 12 is a point between the xiphisternum and the umbilicus and is the influential point for all the hollow organs of the body. When pain occurs in the abdomen, it is always perplexing, and apart from an intra-abdominal source, it may be stemming from other parts of the body. Referred pain in the epigastric region could be related to the heart or lung, and symptoms pertaining to them should be ruled out. Pain may often be due to hunger, overeating, and even drug withdrawal. An abdominal pain can manifest in different areas depending on the organ location. By treating the right organ and its associated acupuncture point, the pain should disappear. 2 acupressure points, the large intestine 4 and stomach 44, can be used universally for any abdominal pain. Stomach 36, which has a homeostatic point, caters for ureteric colic, biliary colic, menstrual pain, intestinal colic, and gastric pain. So these 3 points, namely the large intestine 4, stomach 44, and stomach 36, can always be used when the source of pain is uncertain. Spleen 6 can be added when the solid organs, namely the liver, kidney, and spleen, are suspected of being the source of pain. Acid symptoms differ from person to person depending on the etiology. Burning pain sensation felt in the epigastric region due to peptic ulcers are related to timing of meals. Most common acid reflux symptoms are chest pain and burning sensation below the breastbone. Acid reflux and heartburn can be triggered by a number of factors like different diets and lifestyles. Medical conditions like pregnancy, hiatal hernia, gastroesophageal reflux diseases, and ulcers. Medications such as aspirin and non-steroidal anti-inflammatory drugs can also result in an acid reflux. CV12 or conception vessel 12 is an effective pressure point used in the treatment of heartburn and acid reflux. It is located on the midline of the body halfway between the breastbone and the belly button. Stimulating this point helps in relieving heartburn, indigestion, constipation, stomach pain, and abdominal spasms. Stomach 36, because of its homeostatic effect, should always be used along with CV12. In case the acidity is associated with acute pain, then stomach 34 should also be used. 3 fingers above the lateral end of the upper margin of the patella is stomach 34. Stomach 34 should be stimulated for about 30 seconds at a time at 30 to 60 minute intervals to get some relief. Coming to nausea and vomiting. Nausea is that unpleasant feeling of need to vomit, and vomiting is the forceful expulsion of gastric contents caused by involuntary contraction of the abdominal musculature. Vomiting should be distinguished from regurgitation, which is the spitting of gastric contents without nausea and without forceful abdominal contractions. The effective point for treating nausea and vomiting is the P6 point on the pericardium channel. P6 is located 3 finger breadths above the wrist crease on the forearm in between 2 tendons, as shown in the figure. These tendons become prominent when the fingertips are brought together. Stimulation of P6 also alleviates nausea and vomiting due to pregnancy and also prevents post-operative nausea and vomiting. To treat constipation, one must drink more water, eat more fiber, and also exercise more. A very safe, effective therapy in the form of acupressure can relieve you from constipation. Use your thumbs to apply sustained pressure on the points mentioned for about 30 seconds, and then make circular motion on that point for another 30 seconds. Apply pressure 4 to 5 times in a day, alternatively on both the sides. The important points are triple warmer 6, which is on the back of the forearm and is located 4 finger breadths above the wrist joint in the midline. The next most important point is large intestine 4, which is in the web of the thumb and index finger. It has been described earlier. The next important point is stomach 25, which is located on either side of the belly button, 2 thumbs breadths laterally. Lastly is stomach 36, which has already been explained in the previous part of the script. Diarrhea is characterized by loose and frequent watery stools, and in most cases is infective in origin. So, apart from measures, namely infection control, binding diets, and rehydration, acupressure may help in lessening the frequency of stools. However, for functional diarrheas, acupressure is helpful and is considered one of a good remedy. The important points are stomach 36, which is the homeostatic point for the stomach channel, and it has already been described. Next is the CV6 point, which is located 2 finger breadths below the umbilicus. The next important point is liver 3, which lies between the first and second toes and is 1 inch proximal to the interdigital web. Lastly, we have the spleen 4 point. This point is ideal for irritable bowel syndrome diarrheas. It lies on the medial aspect of the midfoot. The base of the first metatarsal forms a distinct prominence. Spleen 4 is located in a depression distal to this prominence, where the sole and dorsum of the foot meet. Ideally, while stimulating all these points, after a sustained pressure, one must give circular motion for 30 seconds and preferably in the anti-clockwise direction. Both sides of the body can be used alternatively 5 to 6 times in a day. Dyspepsia is a term generally employed for indigestion, pain and discomfort associated with meals, bloating and fullness of the tummy, and may be having loss of appetite. To harmonize the digestive organs in this disorder, the stomach's 36, spleen 6, and CV12 are the most important points that are generally used. Pressure on them for 30 seconds at a time, 5 to 6 times in a day should be done. Irritable bowel syndrome is associated with abdominal pain and cramps, excessive gas and bloating, and above all, change in bowel habits. Normally, constipation and diarrhea alternate. The points that are helpful in this syndrome are large intestine 4, pericardial 6, stomach 36, and spleen 4, which is particularly used for alternating constipation and diarrhea. Pressure for 1 minute several times a day and stimulation of these points have a healing effect and reversal of the symptoms in irritable bowel syndrome.